I'm Meghan Miller. I'm an assistant professor in the Department of Psychiatry and Behavioral Sciences and the Mind Institute at UC Davis. So my work is really focused on trying to understand the relationship between autism and ADHD, and in particular looking at early markers of autism and ADHD in younger siblings, so siblings at risk for autism or ADHD. We know that these two conditions, autism and ADHD, are very highly comorbid, so anywhere from 40 to 70% of children with autism may also meet criteria for ADHD, but we don't really know why. The assumption is that there are genetic contributions that are shared between these two conditions, but we don't have a ton of information on exactly how they're related. So in this study, we were really interested in trying to understand the recurrence risk, or the likelihood that a younger sibling of a child with autism or ADHD would have autism or ADHD themselves, both within diagnosis, so looking at the risk for autism in younger siblings of children with autism and the risk for ADHD in younger siblings of children with ADHD, but also across diagnoses. So looking at the recurrence risk of ADHD in younger siblings of children with autism and vice versa. We found that recurrence risk was elevated for younger siblings of children with autism to have autism themselves, which is really confirming something that has already been shown in previous research. We also found that younger siblings of children with ADHD were at elevated risk for ADHD, and this is the first study that we know of that has looked specifically at younger siblings of children with ADHD. And then we also found elevated rates across these disorders. So younger siblings of children with autism were more likely to have ADHD, and younger siblings of children with ADHD were more likely to have autism than younger siblings of non-diagnosed children. So this information we think can be useful for just understanding the need to maybe pay a little bit more attention to these younger siblings, to monitor them a little bit more closely over time. And it helps us understand a little bit more about the potential shared causal factors between these two disorders, that there's probably some genetic contributions that are shared between autism and ADHD. One thing that I think is important to note is that although the rates of these two conditions were elevated in younger siblings, most of the younger siblings actually did not develop autism or ADHD. So that's an important consideration to take away from this. I think clinically what this really suggests is just that we should pay a little bit more attention to these younger siblings, monitor them carefully, not only for the same diagnosis that their older sibling has, but also for the other diagnosis as well.